desperate to save a life, especially the life of your children. Is there anything you wouldn't do to keep them alive? The mom in that video, Mieko, is here with us today. And, you know, Mieko, you've been in the middle of a media firestorm and obviously become such a proponent for anything that will help your son. What has been the hardest part in all of this for you?
I've opened the door to a whole new alternative treatment that has been successful with my son.
Mieko, in addition to Joey doubling his weight because of this treatment, you also noticed some other positive changes?
Joey has had an awakening, and that is truly what has happened to my son. I lost him at 16 months. He was saying, "Mom." I feel like I have my son back. I have the son that I lost at 16 months that was saying, "Mom."
As a mother, and I'm a mother and a doctor, we would do absolutely anything for our children, and what you've done for your child and seeing this awakening is just, I think going the extra mile is just fantastic. I really think.
I think any mom with a child with autism, to see their child awaken like that, that's the number one goal, to see your child awaken.
Yeah, my son is now making sounds. He is mimicking my 1-year-old. He has a personality. It's almost like I've given birth twice to Joey. And when we started him on the brownies, he was in the 5th percentile of his growth chart. As of yesterday, he's in the 70th percentile of his growth chart. This has been a miracle.
That's fantastic.
Well, sitting next to Mieko right now is Joey's psychiatrist, Dr. Rebecca Hedrick. She's a faculty member at UC Irvine. How long has Joey been on them? That's one thing I've been curious about.
We started the medication in April, and I made the recommendation, but not the actual prescription.
Okay. So
it's a difficult choice for a doctor.
Yeah, I was very nervous.
So who
about
prescribes the marijuana then?
There's a specialist who specializes in using medical marijuana for several different disorders.
Have you made this recommendation before, or was this sort of a new thing in your practice?
I'd made the recommendation before, but never in someone so young.
And you noticed immediate changes in
Yeah,
Joey?
I was shocked. I mean, our main reason for starting the medical marijuana was because he was starving. He was only 43 pounds and just completely cachectic. I mean, his cheekbones were just completely sunken in, and his eyes were hollow. When he would come into my office, he would kind of just maybe accidentally make some eye contact and just treat me as if I was an object, me and Mieko, just looking at us like we were a chair or something else, having no interest in us as people. After starting to use the medical marijuana, he interacts with us and he makes eye contact and he gets really excited. And instead of being so consumed with all the other objects, the last time he came in, it was so exciting. He kept making this really funny sound and looking at me and laughing and really wanting me to laugh back at him, which to me was groundbreaking. I mean, we don't have any medications right now that treat autism. We have 2 FDA-approved medications that treat the irritability side effect of autism, but nothing that treats this disinterest in personal relationships.
Marijuana is used in the state of California. It is a licensed medication. The reason it's used for appetite is whether you inhale it or you eat it in something like brownies, the chemical THC travels to the brain, and what it does is it actually signals the brain, increases your appetite, and a lot of people, whether they're cancer patients or as Joey has seen in his own story, but there's certainly a lot of controversies regarding giving marijuana to children. How much do you give them? There haven't been any studies, so we have joining us now the chair of the psychology department at the University of California at Berkeley, Dr. Stephen Henshaw. He specializes in child psychology as well as behavior disorders. So, Dr. Henshaw, I know you've been listening in on this. What are your thoughts as far as medical marijuana when it comes to kids and also the effect on Joey?
Well, I mean, it just does your heart good to hear about a situation that had got really bad with this severe weight loss and autism, and any parent would really try anything. I completely agree. The downside is that there are so many things tried for severe conditions like autism, and something may work for any particular child, but what we really need is an evidence base. But in this case, the appetite stimulation seems to have led to a really good chain of events. My concern is that families don't say, my child with autism, if only they get marijuana, they'd be cured too. We need a lot more research on what the mechanisms are. So I'm really happy for Joey, but I'm going to be a bit of a cautionary teller here too, because we need a lot more research.